Good morning, everyone. Distinguished speakers, dear guests, my name is Harula Christodoulou, and I'm a board member of the Society of Inter-Balkan Women's Cooperation. It is truly a pleasure to welcome you to today's webinar titled The Role of Creative Arts in Promoting Mental Wellness. Before we begin, I would like to warmly thank the International Center for Black Sea Studies, ICBSS, and the Organization of Black Sea Economic Cooperation for taking the initiative to organize today's webinar and for choosing a topic that is really very critical, timely, and deeply relevant to our societies. I think that mental health has become one of the defining social and public health challenges of our time. And at the same time, we see that there is a growing recognition that creativity, culture, and artistic expression are not simply forms of entertainment, but they can also play a meaningful role in emotional well-being, resilience, and human connection. So today's discussion brings together experts from the fields of public health, culture, education, community engagement to explore how the creative arts can contribute to mental wellness and strengthen inclusivity. Before we start, I would like to share some brief housekeeping notes. As you may have heard, this webinar is being recorded and it will be uploaded on the ICBSS YouTube channel. We kindly ask you to keep your microphones muted unless, of course, you are invited to speak. And if you would like to pose any question, please use the raise hand button or write your question in the chat box. We will do our best to address as many questions as possible at the end of each session. So, without further ado, I would like to invite Mr. Georgios Mitrakos, the Director General of ICBSS, the International Center for Black Sea Studies, for his welcoming remarks. Mr. Mitrakos?
Thank you, Harula. So, esteemed speakers and participants, on behalf of the International Center of Black Sea Studies, it is a great pleasure to welcome you all today in today's webinar, a timely event to raise awareness on mental health and the transformative power of culture as a means of mitigation and inclusivity. The ICBSS, for those who are not familiar with it, is an independent research and training institute focusing on the wider Black Sea region and focusing on advancing knowledge, advocacy, and synergies across the wider Black Sea region. It is also a related body and think tank of the BSEC organization. It is the first time we touch upon this very important issue, as mental health is a fundamental part of our overall well-being. The ancient Greeks recognized this with the famous saying, a healthy mind in a healthy body. And after that, the Latins also recognized this with the saying, mens sana in corpore sano. The idea that true health comes from balancing intellectual pursuits with physical activity. Today, the UN recognizes mental health as equally important as physical health. Yet, it is still stigmatized, often poorly treated, or even silenced. According to World Health Organization data, more than 1 billion people live with mental health disorders, such as anxiety and depression. Mental health conditions are the leading cause of death, illness, and disability globally. The WHO reports that every 2 seconds, someone under the age of 70 dies from non-communicable diseases, which among others include mental health conditions. As more people are affected by mental health challenges, there is a growing need for effective support frameworks designed to address the diverse needs of people in modern societies. Cultural engagement can contribute significantly to mental wellness, leveraging inclusivity, understanding, empathy, and reduce isolation and challenge societal stigma. Today's webinar aims to highlight that the path to healing, to well-being, is not a solitary one. Throughout history, societies have turned to art, music, storytelling, and shared traditions for comfort and connection. We are glad and honored to welcome today a diverse lineup of health experts and culture practitioners that will share with us their unique perspectives and valuable insights from innovative approaches for mental health care. Our aspiration is not only to be informed, but also motivated to take action with new projects and joint initiatives across the wider Black Sea region. The webinar is an opportunity for open dialogue. Therefore, I would like to invite you all to share your views and ideas during the sessions. Concluding, I would like to cordially thank our distinguished speakers and moderator, our friend Haroula Christodoulou, for their cooperation, interest, and willingness to participate in today's webinar. We look forward to having fruitful and inspiring discussions. Thank you.
Thank you very much, Mr. Mitrakos, for your kind words and, of course, for your thoughtful remarks and for the hospitality and support not only of you personally, but of the entire ICBSS team in organizing this event. So, it is now my honor to invite Ambassador Dimitrios Rallis, the Deputy Secretary General of BSEC, for his opening address.
Thank you very much, Mrs. Christodoulou, Ms. Moderator. Allow me to start by sincerely thanking all of you on behalf of the BSEC Permanent International Secretariat, all of you for joining today's very important webinar on the role of creative arts in promoting mental wellness. A webinar that is being organized together with the International Center of Black Sea Studies. This is a subject that touches each of us in a different way, in different ways. Mental health is increasingly recognized as a vital part of overall well-being. Yet many still face silence, stigma, or isolation when confronting mental health challenges. Most importantly, this is something that we should seriously take note of. This is affecting, but very strongly, the young generation, who is facing multiple challenges in a complicated world. It is our role to encounter, it is our role to encounter very many ways why and to explore why young people show signs of challenges and sometimes even depression. We heard with sadness events yesterday of young people who committed, two young girls of 17 years old who committed suicide in face of the challenges they are they were confronting. This is why today's discussion is so important. We are here not only to share professional expertise, but also to explore how culture and creativity can help us build more compassionate, resilient, and inclusive societies. And last but not least, help all people, including particularly the young generation, to promote mental wellness. Creative arts have a unique ability to connect people. They offer expression when words are difficult, create dialogue when division exists, and often provide comfort, healing, and a sense of belonging. Whether through music, theater, literature, painting, or community initiatives, culture can serve as a powerful tool for emotional well-being and social connection. Culture shapes the way we understand ourselves and others, and when it embraces openness and creativity, it can reduce stigma and isolation and foster environments where mental health is valued. In such a way, culture and mental health are deeply intertwined, each reinforcing the other in building stronger and healthier communities. We consider the overall matter very important, of such an importance that we, as a PERMIS, will propose to the chairmanship in office to include such an item in the agenda items in the relevant working groups. This is something that is our duty, and we will also invite ICBSS to contribute with its experience out of this webinar to this discussion. I'm especially pleased that today's panel brings together experts from diverse backgrounds and disciplines. It enriches our experience, and I'm confident that this richness of perspectives will make our discussion both inspiring and impactful. I would like to thank the speakers for sharing their expertise and all participants in advance for being part of this important conversation. We encourage everyone joining online to actively engage, share thoughts, and contribute questions. Last but not least, I would like to thank you, Mrs. Moderator, and ICBSS, Chairman of IBCS, and the staff of it for contributing to the successful outcome of this webinar. Thank you very much.
Thank you very much, Ambassador Alice. Thank you for your insightful remarks and your guidance, and of course for highlighting the deep interconnection between culture and mental health. And of course, we welcome your proposal that this issue should become a permanent agenda item in your relevant working groups. It is really very topical and hot, the issue. So, ladies and gentlemen, now we will move to, before that, sorry, I have to ask all participants if you can turn on your cameras for a while for a screenshot, a family photo, if you can do that. Georgia, are we ready? You will tell us when we are ready.
Fanny will tell us.
Okay, Fanny will tell us.
We are okay. Thank you.
Okay, thank you. Thank you very much for this. So we will now move to our experts panel, the first panel discussion, where we will hear valuable insights on current mental health challenges, as well as the myths and misunderstandings behind that. And our first speaker, it is my honor to welcome Dr. Mariam Kavakci. Dr. Mariam Kavakci, you will allow me to read a brief CV. She's advisor to the President of the Republic of Turkey and Associate Professor of Speech Language Therapy and Neuroscience at Ankara Yildirim Beyazit University. She holds a PhD and dual master's degrees in Communication Sciences and Disorders, as well as Applied Cognition and Neuroscience from the University of Texas at Dallas. She is also the founding manager at the Cognition, Communication, and Swallowing Rehabilitation Laboratories at Ankara Bilkent City Hospital, combining clinical expertise with education and healthcare innovation. Dr. Kavakci, the floor is yours.
Thank you very much for that kind introduction. I'm very happy to be here today. First and foremost, I would like to begin by thanking Ambassador Domi and the organizing team for inviting me to this webinar and to everyone who's here today. When Ambassador Domi first told me about this topic, it really deeply resonated with me. Art is vital to mental health, especially in the world of clinical science. So I'm very, very happy to be here today and to share my presentation with you. I hope you can see my presentation.
Yes, we can.
Wonderful. All right. Okay. So I'll first begin by talking about the biopsychosocial model to set the foundation for what we're going to be talking about today. So that we can begin with talking about the flow theory. And here you can see in this image a flow channel that on the x-axis we have the skill level, and then y-axis we have the challenge level here. And so the flow channel is that kind of sweet spot, if you will, between anxiety and boredom. So we have this zone that we want to be in to achieve that flow state, which is the deep immersive engagement that is intrinsically, internally, innately rewarding and linked to well-being. So this is something that we achieve naturally, not necessarily with where something that we have to put a lot of effort into. And this is actually the core psychological mechanism in artistic practice. We'll jump directly into some of the core principles in neuroscience and some of the more recent findings that we have established. So that's the first thing I want to talk about is the default mode network. And here I'll give some visuals. I'm not going to go into specific neuroscientific details for the sake of time, but you can see a little bit here what the default mode network consists of. So briefly, I do want to preface by saying in the past 20, 30 years ago, we used to really think of the brain in modules or sections, but now we're moving more into networks and connections. This has been really, really important for us over the past 15, 20 years. So the default mode network is active during rest, self-referential thought, and introspection. It's basically what is your brain doing when it's not doing anything explicitly or consciously. And it's profoundly engaged and modulated by arts-based activities, not surprisingly. And I want to talk about this very seminal study in Nature Neuroscience, which is the top journal, as I'm sure you have heard in all of the sciences, about music, dopamine, and reward. Anatomically distinct dopamine release during anticipation and experience of peak emotion to music was documented by these authors of the study that was published in 2011. And this shows us direct evidence that pleasurable music listening triggers dopamine release in the brain's reward pathways, such as the striatum, which is here pictured in red. And if you are familiar with some neurodegenerative diseases such as Parkinson's, you know that the main mechanism that is affected is the dopamine system. So we can already make some hypotheses here about how music increasing dopamine release and supporting that might be therapeutic for neurodegenerative diseases such as Parkinson's, which also come along with some mental health difficulties such as depression, anxiety, etc. This is just one small example. We can also talk about visual arts and brain connectivity. So studies examining effects of visual art production on functional brain connectivity and stress have been completed over the past decade and a half. Creating visual art, such as drawing, painting, or anything of that sort, enhances functional connectivity in the brain's default mode network and between prefrontal and cortical regions, suggesting it promotes integrative brain states and cognitive resilience. This is another study here. I just wanted to share the image where you can see actually the planning for visual production of visual artwork. Just the planning process itself engages so many different brain areas. And again, this is all functional connectivity, which is really what we've moved into over the past 2 decades, rather than just isolating each area and examining it individually. You could see the visual cortex and the prefrontal lobe. So we know that the prefrontal lobe is so important for executive functions such as planning, organizing, and these types of things, and attention. So it's not just the visual cortex, it's those connections between the prefrontal cortex and the visual cortex as well. If we take a look at the effects of art on social bonding, we see that in activities such as music production, music making, synchronized group singing or drumming, for example, leads to interbrain synchrony and correlated cortisol levels among participants. And cortisol, as we know, is the stress hormone. So you can imagine how, as in a coordinated group, as you're producing music, everyone's cortisol levels together reduce, and that you see that interbrain synchrony among the participants. This provides a neural and physiological basis for art's role in building social cohesion and reducing feelings of isolation. And my favorite is dance therapy and its effects on neuroplasticity. So dance, which we know combines music, movement, emotional expression, has been shown to induce neuroplastic changes in motor and cognitive brain regions, such as the hippocampus, which is the memory center, basal ganglia, which is very important for movement, as well as some cognitive functions. So improving motor function, memory, and mood in clinical populations. This was one study. And then another study, we have a nice visual here that shows the effects of dancing on different brain variables. So we see increased brain volume, increased brain activity, increased blood flow, increased dopamine, and some other wonderful effects like hippocampal neurogenesis. Neurogenesis is the birth of new neurons, which is very rare and limited, but we see this in the memory center with dancing therapy, and many, many other benefits. And I think the key factor here is the art piece of it, as well as the movement. I think, as we know, movement and physical activity is very, very important for the brain. So when you can combine that with art and emotional expression, it's just a perfect trifecta. Then there are also actual therapies that use art, such as MBAT. So this was discovered a while ago by a researcher named Donna Betts, and she actually looked at fMRI studies, which is functional magnetic resonance imaging, which is not MRI, but it's a functional video active version of the MRI. So you actually see and document the blood flow, and the spatial resolution on that is actually really great. Not so much the temporal resolution, but for the purposes of these studies, it's very, very effective. So her and her team found that combining mindfulness with art making shows downregulation of amygdala activity. So the amygdala is a small structure in the brain, subcortical, that is known as the fear center. And she also found strengthened connectivity between the prefrontal cortex and amygdala, indicating improved emotion regulation. Just to give you an idea of what MBAT looks like, it could be something like draw a picture of yourself, use art to express your emotions, create a collage, paint and walk. Now notice if you feel better after you make the art. I'm going to talk very briefly about culture as well, because it's so important for us in different parts of the world. So there's indigenous practices such as beading and carving, weaving, African diaspora practices such as drumming and dance, quilting, Asian practices such as calligraphy and mindfulness. And as you can see, all of these have been examined scientifically. So people are continuing to research these, and these are fairly recent studies. So I'm sure in 5-10 years from now, we're going to have much more research in this area. In terms of Anatolian art forms, we have Ebru, which is marbling and mindfulness. We have Teship, which is illumination art, and Hat, which is calligraphy. And these have been researched, their effects have been researched on cognitive focus. We have Sufi music and rituals, which are just so peaceful and wonderful, even thinking about it. If you have listened to Sufi music, you know what that feels like. Sema we have the whirling dervishes, their show, and how peaceful that can be, participating in that as well as observing it. And then ney is a very special musical instrument. It's a type of flute, and these have been, the effects of these on heart rate variability especially have been examined, and their positive impacts on heart rate variability, which is very directly and indirectly connected to mental health status, especially transiently. There's kilim and chini. Kilim is rug weaving, and then chini is ceramics, folk music. And then we have humor and narrative therapy, which we have Nasreddin Hoja. You may have heard of him. He's a character that we use to tell stories and make jokes, but there's always a very nice message behind the stories and jokes. And this is very helpful for reframing cognitive distortions. And all of these, again, have been studied scientifically. Some of them more preliminary and pilot work, some of them actually very strongly designed studies. And these are just some examples. So there's a lot out there. And then finally, I want to talk about Turkish art forms and worship forms, actually, and their impact on well-being. So we have something called toplu zikir, which is collective zikir or remembrance. And in the images here, you can have an idea of what that looks like. So this is a religious practice by Turkish Muslims, especially, but they have it in different parts of the world as well. And the impact of this on brain synchronizations, kind of similar to music, is being now investigated by Istanbul University. And their preliminary findings suggest interbrain synchrony among participants during rhythmic zikir, similar to findings from group singing or drumming. So this neural coupling is hypothesized to underpin the profound feelings of unity, belonging, and transcendence reported by participants. And it's just a very different feeling once you experience that, the social aspect of it, the cognitive aspect of it. It's just it's psychological, of course, aspects of it. So I definitely recommend this. If anyone's interested in trying it, I can refer you. I think I definitely recommend that it should be tried at least once in one's lifetime. So in conclusion, we have robust evidence that arts-based interventions can help meet major health challenges and reduce reliance on medical services. There's sufficient evidence to support the role of arts in prevention, treatment, and management of mental and physical illness across the lifespan. So cultural art forms are not complementary. They should not be thought of as so. They are often primary vehicles for psychological processing and healing. And they offer a culturally coherent language or syntax, an outlet for expressing and diminishing stress. So of course, I believe that we must integrate arts into public health policy. And some parts of the world have done this, such as the EU. They have a report on this, but I think it can be more, it can be applied in other parts of the world as well in different ways. Thank you very much.
Thank you, Dr. Kavakci, for this very insightful and interesting presentation. I believe you helped us better understand the powerful relationship between creativity, neuroscience, and emotional well-being, and how artistic engagement, any kind of artistic expression or activity, may positively influence the brain and emotional resilience. So thank you once again. I would like now to invite Professor Albana Fico from University of Medicine of Tirana and former Director General of the University Hospital Center Mother Teresa and the Public Health Institute of Albania. Professor Fico specializes in pulmonology and internal medicine and has authored numerous research papers on public health and clinical respiratory medicine. Her work has focused extensively on public health systems and community well-being. So, Dr. Fico, we are listening. The floor is yours. Dr. Fico, can you hear us? So, dear participants, if we can bear with us for a while, I'm sure we will sort out the issue soon. Dear Georgia, do you know if Dr. Fico is connected?
Yes, yes.
I am.
Okay.
Yes, I am.
Okay, perfect. Thank you. But still, we cannot see neither hear you.
Both my options are
Okay.
okay.
Here you are. Here you are. So, please.
Well, I missed what you might have said during the disconnection,
Oh.
but
So we spoke about the
yes.
If I may, we spoke about the relationship between neuroscience, creativity, and emotional well-being. Then I presented your CV, and now we are here to listen to your presentation. I think you will be speaking about the broader public health perspective of mental well-being, right?
Exactly.
Okay, so the floor is yours, Dr.
Thank you. Just me. Well, I don't, I can't tell you how, do you see me on the screen? The sharing, the presentation, do you see it on the screen?
We can see
Yes.
your presentation. Yes, of course, you may go ahead.
Okay. Let me just get a little bit more comfortable with this because
If you can just maximize the screen. Yes.
yes.
Okay. Perfect.
Well, when I got this invitation from Ambassador, I was thinking of it as a very important task. Not only because mental health is part of the overall health, but we also are in the month of mental health awareness, and we should do more in order to be present, not only during the month of May, but also the entire year. And then I thought, what could I do as a doctor? Because I have faced so many challenges during my professional life with patients that needed this support, and the understanding and the improvement of science the recent years have made a difference. And I totally agree with the other panelists that this kind of intervention should be part of the public health policy in our countries. In fact, one important thing is the trends in mental health. It is seen and it is recorded properly that we have a 50% rise in the first quarter of 2023 versus the same first quarter of 2022. And in the meantime, during this period, we had a culprit, which was COVID pandemics. And surveys and clinical reports indicate that anxiety, depression, psychological distress remain higher than pre-2020. And this happened especially among women, vulnerable groups, older adults, and these have to be taken in consideration. But if we would like to make changes, where do we start? And it is a policy and system reforms that are crucial to making the difference. And since I chose to talk about Albania in this occasion, it is a mental health action plan 2023-2026 that reflects a normal recognition that mental health disorders surge after COVID-19. So first and foremost, you have to recognize the problem. But then both the Ministry of Health and WHO supported programs have put more emphasis on integrating mental health services into primary care and expanding community-based psychosocial support by implementation, but still this is uneven and mostly centered in the urban areas. Also, this has to be taken as a note. And post-2021, Albania, mental health problems in Albania, and I am aware also in other surrounding countries, remain elevated compared to the pre-pandemics. But they are being made attempts, and there are some signs of improvement and increased policy attention, especially around hospital-based care and workforce support. In fact, 2020, 2023, the government has reduced psychiatric beds from 900 to 600 and shifted to community-based. This is a first, let's say, step that would support more in-home processes and outpatient services. On the other hand, mental health plans, action plans would need an increased funding. This is work has work to be done, and under this plan, it is allocated a large amount of money, but still not enough, because if you see the spending for mental health WHO-related data, it shows that $142 per capita we allocate on the mental health. But on the other hand, we have two sides of the story: inpatient care and outpatient care. Inpatient care still remains crucial, but it is an attempt, as I said, and there are recorded data, that we have more outpatient visit per inpatient admission. On the other hand, inpatient care and outpatient care goes hand to hand by access to services. And still we have a concentration in major cities like Tirana, Shkodra, and leaving rural areas underserved, and many people relying on informal or no care at all. One thing that I wanted to bring up today is the situation with the workforce. As a matter of fact, studied on healthcare workers, and we have a few of them done and taken in consideration large amount of a group of many categories of the healthcare, from doctors to nurses and assistants. We have seen that it is a residual stress that this group of people showed that anxiety, depression, and stress were significantly high during pandemic, but post 2021 has declined, though worries and burnout related symptoms still persist. This puts up in the situation of taking responsibility to follow up and make certain interventions. In the meantime, one of the things that it is important for the healthy mental well-being of the workforce would be the institutional professional support in institutional levels that still have to be improved. Even that Albania, for the moment, ranks among the lowest in Europe in mental health workforce density, especially for child and adolescent psychiatrists and psychologists. These years, let's say 23 to 25, it's an increase in number of specialists being trained in order to enter the workforce. It was COVID-19 that brought world in a standstill. A lot of things changed, and one of the things was disrupted face-to-face services, led to increased isolation and appear to have worsened mental health needs, even though the schizophrenia-related hospitalization stays roughly stable, and we do have an answer for that. We also noticed that alcohol and drug-related hospitalizations fell in 2020, possibly due to reduced access or even reporting, I would say, while demand for mental health care services appears to have grown. An issue that is important to discuss or bring to discussion is that anxiety is rising, and studies for the period 2021 found elevated levels of anxiety, depression, and psychological distress among the general adult population with mild to moderate depressive symptoms, and they are reported in a large group of respondents. And nobody can deny the impact of a pandemic. High-risk groups were those that were touched more by this unusual situation. Women and older adults emerged especially vulnerable, and then we have found higher rates of depressive symptoms and stress-related psychological distress linked to quarantine, fear of infection, and definitely economic insecurity. The reduced access, the effect on access to services, and this is not only on the mental health field, but also other fields with a higher percentage of prevalence in the world, such as the cardiovascular, for example. On the other hand, digital or remote mental health options were limited. And so many who might have needed help, especially in those areas of low income and rural, could not switch to telehealth, effectively shrinking the access. And then it is the systematic risk during the pandemic, which led to underfunding of mental health. And I don't think this is an Albanian issue only, because those priorities shifted towards the control of the infection. But then you can only expose or present issues or problems, and leaving on the side the interventions. And the intervention starts with policy, and the National Plan of Mental Health is one of them. Community mental health, and I elaborated that in the slides before. But we also have the building of the new community mental health centers in Albania, which are 10 new community centers for adult mental health and 3 new specialized centers for children and teenagers. We implemented the green light despite other lines like 127, which is the national emergency headline. And we put together not only the new green line and 111 ALO and 116 ALO, but we also connected all these lines, all the information that would have data or problems, I would say, from the color in one of the lines would be easily transferred. And the other thing is that Albania legally requires to have on-site psychologists in the schools, even that these are more concentrated in urban schools rather than the rural schools. We still need to increase their numbers, because certain times we find that in the periphery of large cities, we still have psychologists that would cover more than one school. But we also need to take in consideration that cultural characteristics of the country and public perception is different from country to country. Stigma, low public awareness, distrust in formal services deter many people from seeking help, especially in rural and conservative communities. Funding, as I said, should be increased, and primary care has opened doors to address more of these challenges. But besides those doctors that serving in psychiatric hospitals and those cases that need to be admitted there, are the other activities? Yes, definitely. And while listening to the previous panelists, I thought myself, okay, I'm not looking at that and these activities in those details, even that I teach neurophysiology in the Faculty of Medicine. But I would like to see it from the standpoint of people that have to know that these kind of therapies, and I totally agree that these are not to be taken only as a supportive, but in certain conditions, they are the primary support for diffusing the psychological situation. These are the so-called alternate activities. And in Albania, we have established specialized services. One of them is the Kukas. Kukas is a city in the northeast part of Albania, with a multifunctional center for psychosocial well-being. And this is an endeavor of both Albanian government, Terre des Hommes, UNICEF, and EU. We also have, psychosocial activities for children. And this project was supported by Terre des Hommes and includes activities such as moment, games, and sport, group games like a treasure hunt, creative and emotional activities, group work for communication and cooperation. We also had programs like child protection and psychosocial support programs that include psychological counseling activities, recreational activities, art, and emotional suppression support for children victims of violence. Another program would be Upshift Albania project that is focused more on the youth clubs, creative projects like apps, podcasts, art, stress and anxiety initiative for young people, Unity in Care, advancing mental health support project in consortium with other organizations, and the project it's important because it includes movement, games, sports, and creativity, child resilience programs, community, psychosocial, and on and on. Now, I want to show you some of the activities. But one thing that we have not forgotten about is the fact that these centers would need also the repetitive or continuous education and increased knowledge of psychologists and professionals who provide social care in the first place of treatment of minors. We have one of the things here that you're looking at. This is one of those activities. But then there are also activities that consider, and to your right, you see an activity of one of the marginalized groups, which is those of Roma. And then we also have noticed a track that doesn't do anything else beside the fact that goes from place to place and move to Shankol, and with the students of a particular school. And this track brings objects and also personnel that play or organize the psychosocial games. Now, I don't know if you can see this, but I don't know if you perceive the energy of that video. That video is part of a program which is called Move and Be Happy. As a matter of fact, that video, I recorded that video because during pandemics, as you know, after the quarantine, people had a hard time going back to work even with the limitations. And you can think of children that they had a harder time going back to school. So at the time, I was leading the Institute of Public Health, and we thought of a situation where we would bring children to school, but by, in brackets, treating them through an activity which was moving and dancing. And we monitored even that one of the problems that I believe all these mental health programs have is the recording of the results. That is a difficult one. It's not like in the rest of the medicine. But one thing that we knew for sure in the two schools, we had students coming back to school, and we were told by student parents and teachers that this morning activity that was led by a teacher, by a clown, and by a physical instructor was like a burst of energy. And that is one of the good examples that will show you that arts have an impact even in the worst days. And the thing is that in order to increase this energy, we should continue this kind of activities, because those children there you saw, they were some happy campers. But another thing that I want to bring to attention is the activities categorized by age groups. And there are alternative activities like art and crafts and sport and community programs and in Albania. And when adapted for these age groups, they can function as a powerful tool for prevention and psychosocial rehabilitation, community strengthening, especially in limited resource system like the Albanian for the moment. But we still face challenges there because they are lacking long-term structured program. Definitely funding is important, and the inequality of urban rural coverage. Considering the Albanian context and the possibility for their realization, priority should be for these activities to be simple and free, community-based, not just clinical, should be integrated in schools and municipalities. And then in the next slide, to come towards an ending, we look at the group of 6 to 12 years where we have arts and creativity with things like My Emotions Today, group painting in class, emotional masks, stories with figures and illustration, and then crafts which include paperwork and recyclable materials, plastiline, cargill modeling, collages, My Friends, My Family, My Day, physical activities, collaborative games, outdoor games, free play sports, and community activities such as weekly feeling class and show and tell, which basically are group sharing. Now, even that I came to the last slide, I want to tell you a personal experience. You don't have to be sick mentally in order to get support from arts. Arts are a wonderful thing, and even in those people that might be a little bit anxious or slightly depressed because of something that doesn't go well in their lives for that moment, you find a pillar. And do you know what my pillar was? My pillar were 4 lines of a famous English poet, William Henley, in his most recognized poem, Invictus. And that was something that every time I had a blue day, let's say, I always recited by heart, and I want to recite it for you today. And the last 4 lines say, "It matters not how straight the gate, how charged with punishments the scroll. I am the master of my fate. I'm the captain of my soul." And with this, I want to thank you from the bottom of my heart for listening to this presentation. Take care of your mind, and greetings from my beautiful country, Albania.
Thank you very much, Professor Fico. Thank you really for this insightful presentation and, the broader public health perspective of mental well-being that you brought into the discussion. It was really very helpful. I would now like to open the discussion with a few questions to our first speakers. So I will start with Dr. Kavakci. You said that actually your presentation referred to the idea that the arts can rewire the brain. Do you think that creative activities help prevention and well-being only, or they can also support recovery from trauma, from anxiety or depression? And how?
Yes, that's a great question. Of course, other than promoting mental health and wellness, these arts and activities have been shown robustly to also support healing during the post-trauma. So this can be anything from traumatic brain injury to stroke, or even things like neurodegenerative diseases like Parkinson's or Alzheimer's disease. So I did mention in my presentation neurogenesis, which is the birth of new neurons, which again was something we didn't know 25 years ago. We thought it was impossible. And so with some of these techniques and therapies that incorporate art, we can not only heal the mind, we can actually physically and structurally fix and promote the well-being of the actual organ, the brain. And this is really miraculous and very promising. So it's definitely a very interesting line of work that I'm excited to see the future of.
Thank you. Thank you. One more question. Do you think that engagement with the arts can help combat loneliness and social isolation, especially with young people or older adults?
Yes, I think for both groups, this has a lot of potential, especially arts that incorporate multiple people. So the music making together example or dance therapy. So dancing individually versus dancing in groups. I'm not sure if randomized studies have been done on this, which is our strongest type of study, randomized control trials, but I do know that there's some work on therapies that incorporate others into the actual therapy, whether it's a caretaker or a friend or somebody else. And these are really, really promising. Again, these results showing that it can help with isolation, with depression, anxiety, and even other things like communication with language, for example, incorporating other people into the therapies. This can a lot of times, even in speech language therapy, for example, if we have group therapy, this can have a lot of good impact for the social aspect and the psychosocial well-being of the patients, in addition to the actual speech language therapy itself.
I see. Thank you. Professor Fick, I have a question for you. I don't know if you can listen to us. What do you see as the biggest challenge in mental health support systems in Albania and in the region? If you have any, idea and you can tell us. Are there any remaining gaps that have to be filled? Professor Fico, can you hear us? Okay, while Professor Fico, is trying to connect, Dr. Kavakci, I have a last question for you. Do you think that governments and public institutions treat access to culture and the arts as part of a broader well-being policies? Is this something that should be initiated by governments?
Yes, I definitely think that it should be more widespread, these policies. And I do know that there are some governments that are applying this, as well as the Turkish government. We do have some good work on this, but I think we need to really increase the recognition, I think, and how important it actually is. And webinars like this are why this is so important. So I think people get surprised anytime I talk about the evidence because they know from personal experience usually that these therapies and these activities are very helpful. Yes, it does make me feel better, but I didn't realize that it could help Alzheimer's patients or traumatic brain injury patients or even PTSD, OCD, these types of mental illnesses. So once they see how strong the evidence is, I think people are more convinced. So I think our governments can continue to support this, and if there are governments in other places that don't implement it, I think they should definitely look into the evidence and try to make it part of their public policy planning and programming.
Okay, thank you. I see that Professor Fico is not yet connected, but I see that we have a question from the audience. Miss Yonida Diko, you raise your hand. Can we hear your question? Miss Diko? Okay. Apparently that was done by mistake. So if Professor Fico is still online, Georgia and Elpida, can you please help us?
Yes, I do not see her, unfortunately. I think she has a connection problem. Maybe we can move on to the next panel, and in the end, in the Q&A session, if Professor Fico joins us, we can. Thank you,
Okay,
Harula.
sure. Yeah, thank you. So, our first two experts, they have set the scene from the scientific and public health perspective. And we can now move to the second panel. This panel will focus on specific creative and cultural strategies that promote positive mental health while also We will listen to successful case studies and innovative initiatives that have been launched and encourage, of course, cultural participation and well-being. And it is my pleasure to introduce Dr. Margarita Alexomanolaki. She is head of the Art on Prescription program and head of the Performing Arts and Cinema Directorate of the Greek Ministry of Culture. Dr. Alexomanolaki studied piano at the Hellenic Conservatoire and musicology at the National and Kapodistrian University of Athens. She holds a master's degree in ethnomusicology from University of London and a PhD focusing on music and memory in television advertising. And since joining the Greek Cultural Ministry in 2009, she has worked extensively in cultural policy development and implementation in the performing arts and cinema sectors. Dr. Alexomanolaki, would you like to say a few words about the Art of Prescription initiative that was recently launched by Greece? Can you hear us?
It's an honor to be invited in this webinar. Thank you so much for all the presentation you did before me, for me. Thank you.
My pleasure.
I would like to congratulate the two previous speakers, Dr. Kavakci and Dr. Fico. Excellent presentation, excellent points of view.
They were indeed.
Very, very interesting. And I think they are connected to what I'm about to present now. I would like in advance to apologize because I haven't prepared a PowerPoint presentation due to, as you see, I'm at home. I'm still on leave, sick leave. I was ill for about 10 days, so I'm glad I recovered and I'm good enough to talk to you right now. So basically,
you feel well now.
I will focus my my presentation in a couple of points. First of all, health is not the absence of illness. It's the presence of physical health, emotional health, and mental health. And those three strands are what we say well-being. So I'm more than positively agreeing with the two speakers before me that the brain and the health in our brain is what makes, the physical health progress as well and the emotional health as well. So we do need to be healthy in all these sectors. Just to say we are healthy enough. Well-being is what we're asking for. So Art on Prescription program, what is it and how it started? It is an intervention that was an initiative of Ministry of Culture of Greece. It was a program that started in 2021, initiated during COVID pandemic. And its aim was to integrate art into mental health care. The change of the way of life during COVID was the reason why we started that. And also we were inspired by the World Health Organization report findings on arts and well-being as well. So this whole program was funded by under the Greece 2.0 National Recovery and Resilience Plan. It was all integrated there. The main goals were to bridge culture, health, and social care and encourage health institutions to refer to citizens to art programs and ensure accessibility across all age groups. It basically had two strands. The first strand was the research. This was under the scientific supervision of the University Research Institute for Mental Health, from the Athens University, which was an excellent group of people from psychiatrists, psychologists, and general mental health professionals, that they created the framework where the workshops will be implemented. The second strand is the workshops, the pilot actions, as we said. So the Ministry of Culture made a call and called all the cultural institutions in Greece to participate in this program. We had museums, concert halls, galleries, art museums, modern museums, dance institutes, and drama theaters, plus some cinema festivals. So there were 23 institutes in total, and all these conducted 50 workshops within 2 years. In fact, 18 months. The workshops were 3 months duration. The groups of people were from various mental health illnesses. Usually they were stressed, with anxiety disorders, depression, and even from mental health issues or battles they had to give due to other illnesses like cancer. So we had women fighting cancer with depression. These workshops had a total duration of 3 months, where once per week, for at least 2 hours or 2.5 hours, there were 1 hour or 1.5 hour the art project, and at least half an hour conversation. There were 2 coordinators in each workshop. One was the art professional and the other was the mental health professional, the psy professional, as we called them. So they designed the workshop, these 2 coordinators, according to the art and the group they had, the group of people and the mental illness they had to deal with. And at the end of each workshop, there was definitely group discussion on their feelings. This led to excellent, positive results on this research, that people that were engaged with art, either passively, as I say, or energetically, experiential, or just watching. They could do a drama game, or they could watch a show. They could play music or be part of a choir, but on the other hand, they could watch a concert. So it's actually energetically be involved or be in contact with the art of their choice. We discovered that there was a big change in the way they felt, and a great progress. Of course, you can understand all that. The previous 2 speakers just, presented the proof that the brain is working very well with this the art aim, and of course there is an improvement. But what I'm about to say now is that we have passed a legislation in Greece, and we have managed to customize the platform for prescription. So the platform will include from now on cultural conventions, workshops, 3-month workshops that the doctor can prescribe to a patient. We will start this pilot phase of the prescription on September, and we expect that people will really get into that, because we had about 1,000 participants during this pilot phase, and all these people asked that these workshops will be continued. So we are continuing it, and we're hoping to increase the people that will participate as well, from 1,000 at least to 2,000, and let's see. But I believe in complementing what the two previous speakers have already said, that it is important for the government to have this planned and implemented in the central politics, but not only for people that are mentally ill. I would say for everyone. And I think the mingle between mentally healthy or undiagnosed, if I might say, with someone who is diagnosed with a mental health issue will help each other in multiple ways, together with art. So that's it. My voice is closing again. Thank you very much for listening to me. And I'm here for any questions later.
Thank you very much, Dr. Alexo Manolaki. Before asking any questions, I would like to thank you for sharing these valuable insights and experiences from this newly established art and prescription program. I would like now to invite our next speaker, Ms. Jan Eckert. She's Director and Coordinator of the Culture and Prescription Erasmus Plus project at the Institute for Social Infrastructure in Frankfurt. Ms. Eckert is a social scientist. She coordinated the Erasmus Plus project Culture and Prescription in Europe, and she is also a founding member of the Healing Culture Network, contributing actively to international initiatives or social prescribing and arts-based well-being. Ms. Eckert, the floor is yours.
Yes, thank you very much for the invitation to the webinar and for the kind introduction. Our Institute for Social Infrastructure is a private non-profit social research institute, and it's based in Frankfurt am Main in Germany. And we are mainly focusing on people at risk of exclusion, and participation of these people is one of our core work areas. So now I will briefly introduce the Culture and Prescription project. Yes, it has been implemented by partner organizations from Ireland, Belgium, Portugal, the Netherlands, Romania, and Germany. And we have implemented the project in cooperation with the Frankfurt Public Health Department. And it was a collaboration partnership in adult education founded by the Erasmus Plus program and ran until March 24. So overall, the project aimed to develop new approaches to educational provision that combine social prescribing and cultural activities to promote health and well-being and tackle loneliness and isolation. As background information, because I am aware that not everyone is familiar with the social prescribing approach that is well established in the UK, for example, and also in Ireland. So social prescribing is a means of enabling general practitioners, nurses, or other professionals to refer people experiencing social concerns to a range of local non-clinical programs and services. And in most approaches, the doctors usually refer the patients to a so-called link worker, and the link worker prescribes the appropriate service. So just as background information. Our concept includes prescribing cultural activities, which means actually art and creative activities, but the meaning of art and culture is different in the languages. So we decided to call it cultural activities as a broader concept. Such as theater or painting as a non-medical preventive healthcare intervention. And in this project, we focused on people who are affected by loneliness. And we also included healthcare professionals. Recognizing that cultural participation can enhance social connections, reduce stress, and foster personal growth, as we already heard in the other presentations. Culture on Prescription encourages individuals to explore and engage with cultural practices that resonate with their interests and needs. By prescribing cultural activities, we aim to enhance the quality of life and promote the mental well-being and nurture a sense of identity and belonging. And the core project activity were 6 pilot courses in 5 of the countries. Each course involved 10 to 7 participants. Most of them focused on people aged between 60 and 80 years and were led by professional artists. The courses consisted of 8 to 10 sessions, and 2 of the courses were painting courses. 3 were mainly based on theater and acting methods. And the course in Ireland focused on printmaking. And here the participants created images of buildings that were important to them and shared their stories with the group. In Ireland, where the social prescribing systems already established, they worked with local link workers in Dublin. And these link workers referred their clients to the course. In other countries, the participants were mainly self-referrals of people who considered themselves as lonely, and the potential participants were interviewed and underwent screening to determine the suitability for the pilot courses and to assess their needs and interests. The impact on the participants was assessed through personal interviews, evaluation forms, as well as test results obtained during the project. And the participants reported a positive impact on their lives, including improved self-expression and cooperation skills, as well as increased creativity. They also expressed greater willingness to interact with others and greater confidence in social situations. What we observed was a significant improvement in mental well-being in all countries, with a pre- and post-test, and even a reduction in depression among participants in Germany. In the other countries, we didn't test the depression. The impact on the project of the project in Dublin was quite surprising, because as they already had their well-established system, they did not really expect a major impact. But the feedback from the link workers was highly positive, and they received a lot of attention during the project. So the partner in Dublin was the Dublin City University. And in Frankfurt, since the end of the project, a link worker position has been established at the public health department. And she is currently establishing the necessary structures. So it has quite a long-term impact here, and we want to continue it, and also focusing on younger people. Following the pilot, we finalized training materials that were tested during the courses, and they can be found on the learning platform. And we have also compiled recommendations for decision makers. Here we have surveyed 33 stakeholders and practitioners from different sectors in the pilot countries. So I hope I did not exceed the 5 minutes.
No, you didn't. You were right on time, for everything. Thank you very much. It was really very interesting. I would like to ask some questions if you allow. I will start with Dr. Alexomanolaki, and I would like to ask, why do you think it's important for ministries of culture and health to collaborate, more actively, more closely on mental health initiatives, I'm sorry.
Could you please repeat?
Yes, is it important for ministries of culture and health to collaborate more closely on mental well-being initiatives? What is your experience from this newly established
It
art
is
and prescription program?
important. It is important, and I think that although ministries generally of culture are keen on that, and I'm saying that as a national expert on in an open method of coordination group on health and culture in a European Committee, we have seen a lot of participation of ministries of cultures and less participation of ministries of health, to be
Interesting.
honest. And we were seeing, even in the paradigm of art and prescription in Greece, that there were people believing in that from the health sector, and there were scientists that they wouldn't really see it as an important intervention. And I don't know if they misunderstood the place, the position of art and culture with that. I mean, it's not the intention to be involved with art and not take the medicine, not as such.
No,
It's complementary the one to the other. It's having a physical activity and experiential activity together with some medication that someone has to take. So I think it's important politically and administratively. The two ministries have been collaborating, and of course, all this customization of the platform for the prescribing art, it is because of this collaboration of the Ministry of Health, Culture, and the Ministry of Digital Governance. But in any case, we see more involvement of the part of arts, less involvement from the part of health.
Part of the health. And what is the role that artists themselves play in creating, safe and, how can I say, and inclusive spaces for well-being?
I think the artists are the first subjects that experience in first hand the well-being due to art, because this is how they learn to have art as a profession and as a hobby as well, as a way of expression. So I think they do understand that and they support that. Of course, when you have a group and you focus on mental health and on well-being, definitely you need the help of a mental health professional. No matter if, as an artist, you have an experience in interdisciplinary, how can I say it, interdisciplinary practices like music therapist, art therapist, or drama therapist. Because they are artists, basically, they definitely need the contribution of a mental health professional.
Experts.
On
Okay.
that.
Yeah. Okay. Ms. Seckert, I have a question for you now. What inspired the creation of the Cultural Prescription Erasmus Plus project?
The basis was actually that the Frankfurt Public Health Department is really focusing on cross-sectoral approaches. And they also founded the European Film Festival for Generations. In particular, one staff member who is retired now, he was always been pushing forward these culture-related approaches in his department, which I'm very glad of. And yeah, it was actually his idea to start the project, and he was cooperating with Dublin City University, and we had the expertise in managing adult education projects, and we're quite well connected. So
I see. And do you think that European cooperation has a critical role to play in promoting such innovative well-being approaches through culture? Or, I mean, all
yes.
these initiatives should be country-focused.
No, I think there are so many good approaches which are rarely known, and I think collaboration between stakeholders from different countries, knowledge exchange and raising awareness through collaborations and networks and platforms is essential. And we also heard about the open method of coordination for culture and health, in which from Germany no ministry was ready to participate. By the way, I think these coordination can also has a great potential to put it on the political agenda as well.
Sure, yeah. And since you have experience across different countries, have you identified any, how can I say, common mental health challenges across the European societies? Are they unified, or
well, yeah,
that
was our starting point.
Okay.
So given the high prevalence of loneliness even before the pandemic, our focus was to look at existing measures and strategy to combat it. But we found some challenges across European societies that were quite common, like the lack of intersectoral collaboration and in general, and challenges to implement preventive and holistic approaches.
I see. Thank you.
Yeah.
Thank you. Dankeschön. So thank you very much, both of you, for this, exchange of views and sharing of experience. And we will now move to the final part of our discussion, where we will explore how cultural expression or participation can strengthen emotional resilience and social cohesion through, shared practices and community engagement. So I will now introduce Ms. Rarica Zbranka and Ms. Julia Kutsugou. I will start with Ms. Branca. She's Program Director at the Cluj Cultural Center and Co-Director of Romania's Center for Culture, Health and Social Wellbeing. Her work focuses on culture, mental health, well-being, and regional development. She leads the CARE project, which is Culture for Mental Health, and she's lead author of the Culture for Health report. Ms. Julia Kutsugou, on the other side, is a zero-waste artist and educator. Since 2010, she has been designing and leading workshops and community art projects combining environmental awareness, creativity, and social inclusion. She works with children, refugees, students, and vulnerable groups in Greece and in Central America. And I will begin with Ms. Zbranka and ask you, how can we engage people who may initially feel excluded or isolated from cultural participation, or they are hesitant to join such initiatives?
Well, thank you for the invitation. Hello, everyone. It was a very inspiring conversation so far. I mean, the information that we received so far, I think, build a very good background for a practical perspective. What I would like to say for the beginning, when we are thinking about how to engage people that are maybe reluctant towards the arts or don't necessarily believe as yet in the existing evidence, that currently we have solid scientific evidence that cultural engagement, arts engagement, is a health behavior. So it's a health behavior just like movement it is for physical and mental health, or diet. And from that perspective, I think it is important to understand how much time took since, for instance, the awareness of the importance of physical exercise for health became public knowledge, became imparted public knowledge, that everyone now, I think, is aware that if you move is good for you, or if a certain diet is good for you. And I think with arts engagement, we are in the very beginning of this awareness. We have evidence, we have a lot and solid evidence that is growing exponentially in these recent years. But now I think we need to find good ways to make people aware in accessible language of the fact that their engagement with the arts is really supportive of their health. And just as an example, in the care project that you have mentioned, that the Cluj Cultural Center is leading with partners across Europe, we have just launched a few months ago a campaign which is called More Arts, More Wellbeing, which has been rerun in the past weeks in the framework of the European Mental Health Week as an official activity in the framework of the Mental Health Week, to present evidence-based arguments of why engaging on a daily basis with art is good for you. And we are also able to present data that engaging for about 2 hours a week already proves efficient for people's engagement. And if we are to think on how to bring people closer to the arts, I think there are several entry points. One is to have people that they trust recommend engagement with the arts. And this could be if the referral is made in a medical context, that doctors are recommending engagement with the arts because people would trust the advice of a doctor. But it can also be peers, and it can also be friends or family. I think there is a responsibility that we share to take the hand of our friends and take them to the arts. And I would just give you an example of a project that we carried out in partnership with the World Health Organization, the European office, which is called Music for Motherhood, which was a 10-week intervention with 1 hour weekly meetings where mothers, together with their babies, were singing together. And these were mothers experiencing high levels of postpartum depression. So we had research, measurement of depression, well-being, and social support before and after these 10 weeks of engaging with the arts. And what we found was that this type of engagement with the arts not only was reducing
the stress
sorry?
levels. The stress levels.
The postpartum depression, so the depression levels, but the results were comparable to regular therapy. And in the case of mothers with moderate to severe depression, they were even more efficient. And what we can see is not only comparing this efficiency with the efficiency of medical models, but also considering that in the case of postpartum depression, such a non-medical, like not drug-based intervention is much more easy to accept by mother, does not have side effects, and does not bear social stigma, which may be in a lot of our society still associated to having the blues while giving birth. And what's interesting with the availability of engagement is, for instance, in Denmark, where this was so this pilot was carried out in Romania, Italy, Denmark, and some other countries are taking it up right now. We found out that, for instance, in Denmark, once the pilot has proven efficient, it was immediately integrated as a protocol to support mothers that face postpartum depression. In Romania, it takes more time to integrate such interventions into the or let's say official protocols. So it is much more up to the informal channels that were mentioned before, referral from friends and family to such interventions. And I think it is important to also consider the accessibility of these events and the language that we are using. That we don't need to use arts-related language to invite people to engage in such activities. We can mention movement on the dance floor or singing together without saying let's do arts together. It's also important to approach people from where they are. So as we have seen already, traditional forms of art, they are very reliable ways of engaging with good results. So I think we have ways to engage people and bring them closer to the art.
Yeah. And what kinds of cultural activity or any other cultural, how can I say, intervention you think that has so far the strongest impact? Is it music, dance, painting? You know,
I think
do
I
you?
think this is something that probably no researcher would be able to say that one is more impactful than other. Also because different types of art, they mobilize different mechanisms, and we heard the evidence about that. So I wouldn't go necessarily into the details. But also that interventions are very different. Sometimes they involve multiple art forms, and that makes them effective. I think what is important is to be able um, to design, and what the word that we use in this in this professional field is co-design. To co-design the intervention, even if it is an already established protocol, before applying it to a group, to co-design it with the group, to adapt it to the interests, the cultural sensitivities of that group. Now, obviously, there are already some protocols that have been proven effective and are being integrated in even not only prevention protocols, but in
Mhm.
management and treatment of disease protocols. And music for motherhood, that's one of such protocols. It has been mentioned, dance for people with Parkinson's. It is in a lot of countries already part of the holistic integral treatment delivered to patients, and it has also a protective factor, but also it is part of the treatment by reducing depression, anxiety symptoms. And similarly, museum experiences for dementia, especially facilitated experiences for dementia, they have been widely effective in lowering the risk for neurocognitive degeneration. And I think what's interesting with this type of initiatives, we already have museums, yes, they are there. So there's a little effort that is needed to put together the need that comes from the health side and the need for improving well-being in general in our communities, and the existing cultural resources in the communities. And of course, what we need to put on top of that is training, collaboration, systems for collaboration, as we have seen that in Greece has been possible through this piloting of culture on prescription.
Mhm. Okay, many thanks. That was really very, very interesting. Thank you. Ms. Koutsoubu, you are the final speaker. We know that your work combines creativity, sustainability, and education. We have a new element here, sustainability. But I would like to ask you, how does artistic creation, in your case, support emotional well-being?
Because I'm not, you can hear me?
We can hear you. Yes, of course, we can hear you.
Okay, nice. Thank you for the invitation. It's an honor for me to be between all these great people. Well, forgive me for my English, and my field is not to talk, it's more to make, so I will try my best.
Don't worry, yeah.
Well, my profession is, I'm an agronomist, but I always wanted to study art, which my father didn't let me because he thought it wouldn't be appropriate and for a girl, and also I couldn't make my living out of it. So when I finished my studies, I did my dream. It came true. So like Miss Alexomanolaki said, the example, it's myself. I saw how art influenced my health, my mental health, well, my well-being. So I'm a self-taught artist, and I have worked a lot in many fields with many people, and I'm trying to teach them and to share my knowledge about eco art, sustainable crafts, zero waste crafts. So I have an experience living in Central America. I can tell you some examples. I worked with vulnerable groups in Central America, like prisoners, orphanages, women, kids in the street, indigenous people. I remember once a guy that I was working in the prison of men in Honduras. It was the most dangerous country in peace in Europe at that time, in the world, sorry. I was teaching them how to make crafts because to be in prison in Honduras, you had to pay. If you didn't pay, they will letting you die there, just like this. So the people were making things to sell them so they could be in prison. They could have their food. So I was teaching them how to take garbage, not to spend money, and to make things out of waste and to sell them. So I remember once this guy, he told me he was surprised of what he could do with his hands. And he told me, you know what, Yula, I never thought that I could make other things except of, he was a rapist of of kids and a killer. So he told me the only thing that I know to do with my hands is to kill and to rape. I never knew that I could do something like this. So it was surprising for him to know how he can use his hands to create something beautiful, to create something that he could live out of it, and that it would be good and nice. Other examples here, I live in the island of Lesbos, and
may I interrupt you for a moment, dear Julia? So this what you just shared with us, it's really very strong. But I think that this proves that sustainable art practices, I mean any practice, any art practice, can encourage mindfulness and a deeper sense of purpose for people. And this guy that you just mentioned, I mean, it was a very strong message for him. I hope you agree with me. So that I wanted to say, and sorry for the interruption.
Yes, of course. It's I don't know. I have so many experiences of. I have seen how art is working. First of all, like I told you, I have seen it in my mental health. I was an hyperactive kid, and the teachers was always saying to my parents, "Okay, she has a problem. Take her out of the school." When I found art, I found how art can heal me, can heal my problems, and then that's the reason that I wanted to share it. I didn't want to be an independent artist. I wanted to share my knowledge with other people and help them overcome problems or find their talents, because many people, they don't even know that they have talents. So another example, it was guy, I was working 7 years with refugees here on the island, and many times the doctors of the refugee camp was saying to the refugees, okay, before we give you a treatment, you should go to Yulia's workshop to see, to make some stuff, and to see maybe you can avoid taking some pills. And it was an African young guy that he was coming, and he was saying, okay, me, I cannot do anything with my hands. It's not, I'm not artistic at all. Well, for me, these are the best people because they are very humble and they have so many talents that they don't even know them. I gave him some instructions of some stuff to start to do some crafts. Then he became better than me. He started to make some earrings like these earrings that I'm wearing. That's why I wear them so you could see. He started to make some amazing earrings. And he told me that he stopped taking pills for sleeping when he started to make these crafts. This guy, they gave him the green card to go to Athens, to stay in an apartment, to be free, not to be in a refugee camp. And I remember when he left that he was sad because he said to me, you know, I can be in Athens and I can be free, but here I was inside this jail, inside this camp, but I was coming to the workshop and this art was making me feel so relaxed and so happy. So I don't know if it's good that I will be free. I mean, there are examples really, really strong. So, so yes, your I don't know if it answers in your question. Art can be so powerful, and especially the art of using garbage. You know, when you take trash and you transform them in something or useful or decorative, it's very empowering because it trains your mind to see good in everything. If you see a piece of a plastic bottle and after you can transform it in something new, if you do it all the time, it trains really your mind. And whenever you have a difficult situation, you try to find the solution automatically without, and also you don't have to spend money. And also it raises environmental awareness without too much theory. Protect the environment, don't throw garbage. Okay, everyone knows this, but it happens automatically without trying it a lot.
Thank you, Ms. Kutsubu. I liked very much your point regarding, sustainability and environmental awareness through art creation. So I don't think we have any questions from the audience so far, from what I see, but I would like to thank everybody for being here today with us. I think that our discussion reminded us that mental well-being is not only a medical issue, a purely medical issue, but it's also a social, cultural, and deeply human one. I think that Ms. Alexomanolaki has a question because she just rose her hand. And so we are listening to you.
It's not a question. I would like to say that I'm so blessed to hear everybody that participated in this webinar. I'm so happy because we have the same perspective on this art and health project, and I'm really privileged to be part of it. And I would like to mention that I have shared in the chat a link to the documentary film we have created on art on prescription. I'm afraid it's not this version. I will check if this version is subtitled in English as well. But I think that you can see the main philosophy of the workshops and the projects, and there were real people participating. It is subtitled. Okay, thank you. Real people participating. We have their permission to film while they were in the workshops, and there were people, real participants that they're not shown or their name is revealed, but they say how they felt. And I think instead of my presentation in brackets, that film would be a better position in art and prescription in better ways than I try to explain in English and with a bit temperature. But anyway, thank you very much for inviting me and for being a part of this very, very interesting discussion.
Thank you for being with us, and thank you. I mean, if I may say, thank you to everyone who joined this webinar. For me personally, it was a privilege to moderate such an engaging and thoughtful discussion. I believe that the insights that you shared reinforce, the idea that how powerful arts can be in supporting mental health and well-being. My sincere thanks once again to ICBSS and to BSEC for this, especially to Ambassador Alice, Mr. Georgios Mitrakos, Georgia Hanzi, and Ambassador Domi. They were by me all the time. And thank you to you, speakers and participants, for being with us, that you contributed your expertise, your knowledge, your enthusiasm. Let's keep the dialogue going. It's very important. And as Raritza said, the bottom line is that, the motto of the day is more arts, more well-being. Thank you very much. Thank you. I don't see any questions.